So welcome everyone to the August 16th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwizdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, aye. Here.
Austin Magnan.
Austin Magnan, present.
Bill Muller.
Bill Muller here.
And then Jennifer Maynard.
Jen Maynard, present.
All right, and then staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. I know Nancy's off today. Julie Van Arslan from the Alliance. Don't see her. Check. Danielle Edmonds from the Alliance. Don't see. And then Jennifer Nakijoba. I'm sorry if I pronounced that wrong. From the Alliance. All right, so I'd like to open the meeting. Can I get a motion to open the meeting?
Dan Finn, I'd like to make a motion to open this meeting.
Is there a second? Yep.
I'll second that motion to open the meeting.
All right, and then do roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Austin Magnan, aye.
Jen Maynard, aye.
Karen Gwizdowski-Govin, aye. All right, so good evening again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension until April 1st of 2022 of the remote meeting provisions of the March 12th, 2020 executive order that suspended certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law, and there are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website, identifying how the public may join. With Zoom meetings, please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you broadcast could be captured by the recording. Any supporting materials that were provided to the Board of Health members of this are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Prior to us turning to the first item on the agenda, allow me to cover just some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for the topic, and then after they conclude their remarks, I'll ask the Board of Health members if they have any questions, comments, or any motions, and then just basics such as muting your phone or computer when you're not speaking, and then to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. And I think that is it. Oh, finally, any votes taken during this meeting will be conducted by roll call vote. All right. With that being said, I will go over to the first topic on the agenda, and looks like Jennifer has joined us from the Alliance. We'll do the Alliance update, but first, since Jennifer is with us, she wants to speak to us about the Mass Call 3 grant, which I know we're all interested to hear more about. It looks like you're off mute. I know I can't hear her if she's, oops, I think we just lost her. No, that looks like we just lost her. All right. I just went back through my emails. Danielle is off today, so she will not be attending. Julie.
Hello.
Hi, Jennifer.
Oh, hi. Hi, Karen. I've been here for like 6
No,
minutes.
as I was reading my my long-winded spiel,
Yeah.
I saw your name pop up. I'm like, I think she's here. Well, welcome. Thank you for joining us. The board
course.
members, I'll speak on behalf of the board members, we're interested in hearing more about the Mass Call 3 grant. So
Yes, thanks for having me. So I've been doing prevention work in Grafton and other towns for the last 2 years. And so I think some of you know we had the SAPSI grant, which is the Substance Abuse Prevention Collaborative, and the MOPSI grant as well. Those grants ended June 30th. So to replace that, we applied for funding through Mass DPH, and we received that funding. So we're awarded $125,000 per year for 3 years to continue to do prevention work, specifically for the youth. Now, this grant is different from the other two in that it covers alcohol, marijuana, and tobacco. I know that before the pandemic, a lot of our towns were looking for support and guidance around vaping for the youth. So we are able to do that with this funding. In the past, I've worked with Grafton Middle School and high school to do this work. So I've been looking to resume those meetings in Grafton. But it's important that I have youth at the table. So I'm looking to you all, if you have any contacts or any gatekeepers in Grafton who are able to work with me to move this work forward, I'll be looking for that kind of help. So yes, I'm here to reach out to Grafton to start those meetings up. So I'm really excited to continue to do this work, but also really excited that tobacco is part of the work,
yeah,
the
no,
prevention work. So
I know I'm happy to hear definitely the tobacco side of things.
yes,
Obviously,
definitely.
all of it is extremely important, but
I think vaping has been a concern for a lot of our towns and the youth. So I'm looking to get this off the ground, and I'll be attending meetings to give you updates, as well as ask for any planning help needed as I go along. Yeah, so that's it for the new funding for now. Yeah, if you have any questions, let me know. I'm happy to answer them. So MASCO stands for Massachusetts Collaborative for Action, Leadership, and Learning. It's a long, it's a long name. So we abbreviate that to say MASCO 3. Yeah. So that's about
board
it.
members, any questions? Comments, Dan?
Thank you, Jennifer. This is Dan Finn. Yeah, can you send us your contact information?
Yes,
And that'd be great.
yes,
Yeah.
I'll do that. Thank
Thank
you. Yep. So Julie and Danielle will not be joining us, and I'll be giving the other updates as well
Okay.
for the
Well,
Alliance.
there we go.
Yeah.
Any other questions specific to the grant before we jump over to the other Alliance updates?
This is Austin. I have a question.
Yeah.
Jennifer, what do you guys do with the money? Do you guys hold meetings, or do you guys go into the schools and kind of help with work with the kids?
So I usually hold a monthly meeting at the high school in Grafton
Okay.
to work with both the leadership and the youth.
Okay.
But I think that I really cannot do this work without having the youth at the table.
Absolutely.
So prior to the pandemic, the work I was doing, I was most successful in the high school, the middle school in Grafton. I had more youth at the table. They're willing to get the work done. So I'm looking to see how I can have the youth be at the table at the high school. But at least once a month, I'll be in Grafton trying to move this work forward.
Okay.
And I think the idea is maybe to do the Train the Trainer series, so I could have the youth lead the meetings eventually to educate other youth.
Does the school send like representatives from certain grades or like class presidents or something like that?
Yes, sometimes we start off by finding out what youth-led groups are within the school, and then we present to them to see if they'll be willing to do this work with us.
Awesome.
But I find that sometimes the youth that are already doing well in school are the ones who are doing this work. I really would like to engage the youth are already struggling
Absolutely.
in this area. So yeah,
Prone to kind of needing more assistance. Yeah.
yes, 100%. And usually every 2 years we do the youth health survey. So we use that data to inform our efforts around prevention work.
Okay, great.
And vaping was at the forefront of that work.
Yeah, it's been a big concern lately.
Yes.
Awesome.
Thanks.
Nice meeting you.
You too.
Jennifer Maynard.
Hi, Jennifer.
Hi.
Nice to meet you. I guess I would, one thought, I don't know what kind of health program they actually have in the school system, but maybe there could be something where the kids could go and speak at their health classes so that, kids that maybe aren't as eager to engage in the process, it goes to somewhere where they're there anyways, and it's kind of brought to them, and then kind of gets that kicked off.
That's a good idea. I'll bring that to the forefront too.
Sure.
Yes, thank you
Look
so
forward
much.
look forward to updates on offerings and things. Definitely important topics. Great job.
Yes, thank you.
All right. There's no other questions or comments on the grant, then I guess we can jump over to any other Alliance updates that you're going to give us on behalf of Julie or Danielle or
Yes. So I think you both got the monthly update from our director, Karen Clark. So I'm just going to highlight a few items from that report. If you have any questions, please let me know. So in regards to COVID-19, the mask advisory was issued and is in effect as of July 30th. So for folks that have received the vaccine but are at risk of COVID-19, they're still encouraged to wear masks in public settings, or if they do live with somebody who is at a higher risk for COVID-19. But for residents that are not vaccinated, they're encouraged to continue to wear masks, especially in public settings, especially if they're not able to socially distance. And in terms of vaccines and testing sites and the times for that, UMass Memorial is still offering testing on Thursdays and Mondays from 11 a.m. to 3 p.m. at the Mercantile Center here in Worcester. So that's for the month of August. That's still happening. And I guess like staffing updates for under emergency preparedness, recently hired a new colleague. His name is Shane Wagner. He's been with us for about a month. He will be working for the Office of Emergency Preparedness. He's supporting emergency planning in response to about 74 towns in Central Mass, so Region 2.
okay.
And then updates on environmental health. It's mosquito season. So residents are reminded to remember the 5 Ds. I'm hoping we all know what the 5 Ds are. So the drain, dress, dit, and dusk or dawn. And from the report that we received on August 2nd, in regards to mosquito testing, Grafton and surrounding towns are low risk for AAA and the West Nile virus for now.
Hope it stays that way.
Yes, I hope so too. And then some updates under the nursing department. The numbers continue to go up, but specifically for the new variant, the Delta variant. So even though folks are vaccinated, they're still encouraged to wear masks if possible. And if they do have any symptoms, they are encouraged to get tested or isolate as well. And then in regards to resuming activities in Grafton under the nursing department, for the monthly Grafton Housing Authority blood pressure clinics, and for the Grafton Senior Center blood pressure clinics, those have resumed every 4th Thursday of the month. At the Senior Center, the hours are 10 to 11:30. And the Grafton Housing Authority, those hours are 12:30 to 2 p.m. And we are yet to get any state guidance around the booster shot for COVID-19. We don't have any information on that right now. So I specifically work under the community health team. And under that, every 3 years, as you're all aware, we do the community health assessment survey. The deadline for that has been extended.
Okay.
Really, this is to help us understand key problems and things that impact our health in our communities. So it is important for us to do an assessment every 3 years. So we have extended the deadline for that. And that survey is offered in 3 languages: Vietnamese, Spanish, and English. I think I've covered it all at this point. If you have any questions, please let me know.
Any questions, board member? Oh, Dan?
Yeah, this is Dan, Jennifer.
Yes.
I don't think we received, or I didn't happen to receive at least the list of inspections for the last month and any exceptions or concerns or complaints. If you could have yourself or someone from the Alliance, please forward that to our board individually,
Okay.
collectively, whatever, that would be great. Thank you.
All right. I'll reach out to Julie and have her send you that.
Great, thanks.
Good call, Dan. Yeah, I was looking for that earlier. I didn't see it.
All right. Any other questions for Jennifer? No? All right. I'll take that as none. All right. So I think that covers it for the first topic. Obviously, Jennifer, you're welcome to stay if you want. Sure, you're busy. If you have other things, by all means.
Well, thanks for having me.
Yeah, thank you. And it's
And I look
very
forward to
happy to
working
hear
with all
about
of
that
you.
grant.
Yes, very exciting.
yeah.
Yeah. Well, thank you. Have a good rest of your week.
You too. Thank
And
you.
talk soon. Okay, bye.
All right. So next topic is COVID-19 updates. All right. First subtopic is data and variants. Latest figures as of August 16th, Grafton has been informed of a total of 1,228 confirmed positive COVID-19 cases since we started tracking back in early 2020. The number of new cases is continuing to increase in Grafton, the surrounding communities, and the state, and the whole country, compared to recent weeks. For some, putting that number into perspective, compared to when we were seeing weeks a while back where we were getting maybe 0 or 1 new case across a whole week. Looks like from August 6th to today, the 16th, we've seen a total of 15 new cases come in for Grafton. So definitely, and it's similar, you know, respectively speaking, based on the population. So whether it be Worcester or Shrewsbury, et cetera. So it's definitely an ongoing uptick in cases, 8 to 10 or so, maybe in a week, shall we say, it seems like right now. So obviously, you know, like I said, it's very similar to what others are seeing. Worcester County and the surrounding areas are considered to be substantial risk, according to the CDC's classification methods. As you might remember, the state stopped doing their gray, green, yellow, red weekly town reporting for classification. Now the CDC is doing a county-based one. I saw this morning that Massachusetts is either, all the counties are either substantial or high risk across Massachusetts. There were a few holdout counties that weren't substantial or high risk. So far, knock on wood, Worcester County is still substantial risk, not high risk at least. So all that being said, is the Delta variant is here. It's obviously, as we're seeing across the country, picking up steam. The cases are definitely increasing locally and across the country. So individuals are strongly advised to continue to exercise precautions, even if there's not mandates out there. Because as we're seeing also, there are some breakthrough cases where people have been fully vaccinated. And for the most part, thankfully, if you get COVID-19 after getting full vaccination, most people are getting a mild case of COVID-19, nothing that's requiring them to be hospitalized or passing away, no ventilators, but that's not 100% either, because there are some cases of people with breakthrough infections that are worse than just what would be considered almost like cold symptoms. So people need to be diligent about, continuing to try to social distance, washing of hands, wearing of masks, etc. And to kind of tee off into the next subtopic, vaccinations. If people have not been vaccinated, it's still strongly, strongly recommended to get vaccinated. It's, you can get ages 12 plus at this point, have been approved. Pfizer's the only one that's 12 plus, but the rest, whether it be the J&J and the Moderna, are available for the 18 plus population, and people can visit mass.gov, the COVID-19 vaccine site that still exists, that gives you locations, Walgreens, CVS, they have appointments. So, those sites all still exist, even though a lot of the mass vaccinations and those big regional sites have closed down. There's still plenty of vaccine and locations and appointments available. Fairly hot off the presses in terms of vaccines. Last week, the FDA authorized a third dose of either the Pfizer or Moderna vaccine for certain immunocompromised individuals. And then following that on Friday, the CDC now recommends that people with moderately to severely compromised immune systems receive an additional dose of the Pfizer or Moderna vaccine at least 28 days after their second dose. They're saying it should be the same vaccine as your first two doses, but they're not mandating it. So for some reason, someone got Moderna for their first two doses, and now they can't find a Moderna location available around them. They're not saying you can't do Pfizer, but they're saying you really should try to stay with the same version you had before. One call out is the recommendations and authorization by the federal government are not applicable at this time to individuals who received the Johnson & Johnson Janssen vaccine. The data is not available yet to say whether it should be maybe a second dose of the J&J vaccine. Some people have talked about potentially trying, if they got J&J first, going to a second dose of Pfizer or Moderna. That data is not out there yet. That's been reviewed by the federal government. So those authorizations and recommendations do not apply at all to that population at this point. There are also no third shots authorized for elderly, healthcare workers, etc., other populations that have been inquiring about them, unless they fall under that moderate to severely immunocompromised population. I'll quickly read off, since I know I had questions as to what moderately to severely immunocompromised meant, according to the government. The recommendation and authorization is for the following types of individuals: either one, someone who's been receiving active cancer treatment for tumors or cancers of the blood; two, someone who's received an organ transplant and are taking medication to suppress the immune system; three, someone who received a stem cell transplant within the last 2 years and is taking medicine to suppress the immune system; four, moderate or severe primary immunodeficiency, such as DeGeorge syndrome or Wiskott-Aldrich syndrome; five, advanced or untreated HIV infection; or six, active treatment with high dose corticosteroids or other drugs that can suppress your immune system. All that being said, they do say, both FDA and CDC says, individuals who do fall within one of those buckets of classifications should talk with their healthcare provider to, about their medical condition, about whether their provider feels they should get an additional dose and what timing they should get said additional dose. Any questions on data, variants, or vaccination updates at this time? All right, I'll jump over to mask guidance. Some of it Jennifer had quickly covered, but I'll just go back over it in case someone was not watching at the beginning. That's joined us on Zoom. Given the elevated risk level, so the fact that the county now is in a substantial risk area, the CDC advises that all individuals wear face masks when indoors in public places, regardless of vaccination status. And that's, the CDC guidance is for both substantial risk counties and then high risk counties. In addition, Massachusetts had released a mask advisory that said fully vaccinated individuals are advised to wear face masks when indoors and not in your own home. If you have a weakened immune system or you're at increased risk because of age or an underlying medical condition, or if someone in your household falls into one of those criteria to help protect the individual that's at increased risk. Grafton Public Schools had decided to continue with their standing mask mandate that had happened from, I think, last year at this point, where they were saying that pre-K through 12 students, teachers, staff, and visitors have to continue wearing masks. They did ask if the Board of Health has an opinion, recommendation, endorsement of a certain guidance. So we just wanted to bring that up where we were asked. I know Nancy had forwarded everyone the American Academy of Pediatrics recommendation. So Dan, since I'm starting to feel my voice waver from talking all day at work, if you could go through that as you so
Sure.
graciously were asked 2 minutes before
Right.
the meeting.
Right. Yeah, Karen Clark and Jerry Gerwitz, who's up from UMass Education Outfit, sent information about that was recommended by the American Academy of Pediatrics. And basically, I'll read a summary of that. And it says, and they say it is critical to use science and data to guide decisions about the pandemic and school COVID-19 plans. All school COVID-19 policies should consider the following key principles, and remember that COVID-19 policies are intended to mitigate, not eliminate risk. Because school transmission reflects, but does not drive community transmission, it is vitally important that communities take all necessary measures to limit the community spread of the SARS-CoV-2 to ensure schools can remain open and safe for all students. The implementation of several coordinated interventions can greatly reduce the risk, including, and I'm just going to hit the highlights here. All eligible individuals should receive the COVID-19 vaccine. All students older than 2 years and all school staff should wear a face mask at school unless medical or developmental, that's a tough one, that's too many syllables, conditions prohibit use. So the AAP, American Academy of Pediatrics, recommends universal masking in school at this time for the following reasons, and a list, 1, 2, 3, 4, about 10 reasons, with additional benefits, protecting the staff against and students against other respiratory illnesses, including the flu, probably. So again, this is all goes on and on and on. And then basically, with the above principles in mind, the AAP strongly advocates that all policy considerations for school COVID-19 plans should start with the goal of keeping students safe and physically present in school. And again, the importance of in-person learning is well documented. There's already evidence of the negative impacts on children because of school closures in 2020. And again, as Karen said, Superintendent Jake Cummings did propose and recommend and put into place the masking, the social distancing that was there, and according to with the recommendation of the AAP. So I don't know if anyone wants to discuss that, or if we should, vote to ratify or endorse the Grafton Public Schools accepting and putting into place this masking program.
It was less about ratifying or anything and more just
Yeah.
what, does the Board of Health feel, it should be the AAP, endorsement of that. Do we not have a recommendation, et cetera? Because they've already made their decision.
Right. I mean, Karen, this is Bill Muller. I think it would be appropriate to endorse their decision. It's obviously, supporting a recommendation from a very well-respected body. I do think it, unfortunately, it's become more controversial than what it really should be in lots of parts of the country. So I do think in support of the superintendent, it would be appropriate for us to at least be on record that we agree that he should follow the recommendation of the American Academy of Pediatrics.
Austin,
Austin.
I saw Austin, your lips moving, but then I didn't hear anything.
Yeah, I agree with Bill that if it do anything, we should endorse it. Whatever kind of keeps the kids in school, and if masks, the social distancing will help. And the superintendent seems to think so.
I think another related question would be whether there's ever going to be consideration of some school-based vaccination, to try to get a larger proportion of the students who currently are eligible for vaccination vaccinated.
There seems to be a rising concern in town around folks wanting kids in school, but also to Dr. Mueller's point, that being a question or concern, I would say, as well as the masking. So, I would agree. I think Superintendent Cummings is, taking the science into account. I do think that there's going to be perhaps an opportunity for the Board of Health to support them further with education or things like that, because I do think we're going to continue to see some of the issues with people having some hesitancy, having some concerns around both of those things. So I think some support in that decision-making process is warranted.
So if it's okay with everybody, I'd like to make a motion, unless there's any more discussion, that the Grafton Board of Health endorse the Grafton schools K through 12 plus staff in the masking policy as recommended by the American Academy for Pediatrics.
I second that.
All right, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Austin Magnan, aye.
Jen Maynard, aye.
Karen Gwiazdowski, Govin, aye. All right, motion passed. All right, I will let them know. All right, thank you. That was all I had for mask guidance, COVID, etc. Before we jump, anything else on COVID? Dan.
I just want to mention, this is Dan. I think we all have to lead by example individually around town and sort of encourage people to wear masks. I take one with me personally into any retail store. If there's more than one or two people, If I'm just going in to grab some ice cream and nobody's in the store, I don't put it on, but kiddingly. But in any event, I just think it's important that, you know, down the road, we're going to have to watch the numbers in Grafton and take it one step at a time, but it's not going to hurt to get started a little bit early with 1 or 2 masks, or just getting out there by ourselves and leading by example too.
Yeah, I can say I haven't, like, I only go grocery shopping once a week, but I never stopped wearing a mask in the grocery store, because anytime I go, it's usually on the weekend. So of course it's going to be busier. I've been seeing, you know, I was kind of, we'll call it the odd person out for a while. Not that I was the only one wearing a mask, obviously, in the grocery stores, but it's gotten more now. It's like maybe 50-50 since Delta's showed up, but
It does seem that there is more adherence to mask wearing. It's interesting. I think our signage, which seemed to be perhaps not optimally timed in terms of the mask wearing, is looking better now.
I thought the exact same thing when we finally got them approved and we got them printed and everything. We put them up, and then everything was coming down in terms of cases, and we were hitting those like 0 or 1 case a week things. I'm like, oh, that worked, and we finally get them up and everything is going quiet. Well, here we are. I drove by one over the weekend. I'm like, glad we have them. Glad we didn't take them down.
Right, right.
All right. Anything else before we jump over to the last topic? Nope. All right. Tripoli, West Nile, and ticks. Jennifer also went over a good chunk of this. So far, we, once again, thankfully this year, are at a low risk level thus far. We're not out of the season yet. So all of that being said, you know, remember the 5 Ds. I'll just go through them again in case people joined partway through. Dress in long sleeves and pants when possible, especially during periods of mosquito activity. DEET's an effective repellent. Dawn and dusk are the mosquitoes' most active periods. And then drain water from containers regularly. And then the Board of Health does have a variety of information and tips on our website. For ticks, you know, DEET or another effective repellent, do a tick check on each person in your family who's been outside, especially kind of the hard to see areas, the hairline, the scalp, armpits, etc. And then if you have any pets that go outdoors, also please check them each time they've been outdoors. And I know that's not that easy depending on the color of the fur and the thickness of the fur, but it's definitely worth it both for the pet's sake. And then also obviously for the family's sake. And then if I remember correctly, the Board of Health, or the health office, I should say, are putting together some bags that have information with, you know, these tips that I just went through and some others for mosquitoes and ticks, along with some tick twisters. I don't have any pictures in front of me, but it's device that you can use to help try to, if you had a tick on you, it's a safer way to remove it than some of the Googled methods to try to remove a tick, which may leave the head or something still in the skin. And then also like a small first aid kit. And I know there'll be some type of posting on social media once, on the town social media, I should say, once those kits are ready. So we were able to obtain some funding to get some of those put together. Even though we didn't have a night out in town, we still will have those available if someone wants to get some. Any questions on Tripoli, West Nile, ticks? All right. So then, no additional mail or correspondence that I saw. Upcoming meetings, we have September 13th, October 4th, November 8th, December 6th, and then December 27th. All right. That's all we had on the agenda. Dan?
Yep, this is Dan Finn. I'd like to make a motion to adjourn this meeting and have some supper.
This is Austin Magnan. I will second that motion to adjourn the meeting.
Dan Finn, aye.
Bill Muller, aye.
Austin Magnan, aye.
Ben Maynard, aye.
Karen Gwizdowski Govin, aye. All right. Well, thank you, everyone.